We're going to convene the Community Health Board meeting for May 5th. We'll do the pledge for the regular meeting. So we'll start right away with the meeting, and I need to make this announcement. Commissioner Brecky, Weckman Brecky, is attending a conference, the Northwest Interstate NACO Conference, on her behalf. So all votes today are going to be on roll call. And so she's attending remotely right now. So good morning. Okay, so we're ready to go. Item 2 is to approve the minutes of November 18th. Do we have a motion to approve the minutes?
So moved.
Second.
We have a motion and a second. Any discussion? Okay, we'll take the roll.
Commissioner Weckman Brecky,
Aye.
Commissioner Wolf,
Aye.
Commissioner Brennan,
Aye.
Commissioner Beer,
Aye.
and Commissioner Ulrich.
Aye. Motion is approved. Item 3.1 is to receive a Community Health Board report from the Community Health Services Administrator, Public Health Staff, and the Scott County Medical Director. Good morning, welcome. We're excited to hear your presentation.
Good morning, Commissioner Ulrich and Commissioners. We are here today, public health staff and some supervisors and our medical director to do our twice annual Community Health Board report as we meet as a Community Health Board per our statutory requirements in 145A. And as always, we are very happy to have this opportunity to speak with you and tell you about all the good work from our public health department. Today, we are going to talk very briefly about our 2025 community report to the community, hot off the presses. Also, we're going to do an in-depth overview of some family home visiting outcomes and updates about our programs. Do a WIC program update, and I believe this is our first in-depth WIC update that we've had since we took on the program in 2022, and you'll also hear from our medical director. I'm not going to go into it, but at your desk, you do have the report to the community. This is an annual report we do for the community that we are required to do in order to meet our accreditation standards. There are lots of numbers and stories that we have shared for your reading pleasure. We also distribute this. It's online. And it also is, hard copies are distributed at, a few hard copies at our libraries. We don't print a lot of copies anymore because it is available online. Please feel free to read through it at your leisure. If you have any questions, as always, you can reach out and connect with me. The other place I wanted to direct you, while the report to the community is just a handful of some of our successes, we do also have a dashboard that I'm going to try and get to. She showed me twice how to do this. But we do have a very in-depth dashboard that has quite a few measures on our programs. We kind of rolled it out last time, but it is thoroughly updated now. We have all of our programs on this. It is interactive. I'm just going to give you a highlight of one. I'll click on the SHIP one. You can see we have outcomes listed here. We have our partner sites. You can click on these links and you can see how number of new partners. We have our health equity sites. We have some dollar numbers, et cetera. And quite a few numbers and statistics. This is forward-facing. This is available for the public, and this also is a requirement for us to meet our accreditation standards. And now I'm going to try and escape. Okay, that didn't work. How do I get back? I did that. Okay. Let's just do this. There, I'm going to try to make this smaller. Thank you. I'd like the record to show that I did follow the instructions. It just didn't work. So what's coming up in 2026? We did apply for the NACO's Public Health Leadership Academy. This was a highly competitive opportunity for all public health departments in the U.S. They only selected 12, and we are among the 12 projects that are being considered. This is the first time that they're doing this. Our project is going to look at how can we work a little bit better with pregnant moms and parenting moms that are also using substances, and how can we create a more supportive, non-punitive approach to some of that work, and set some groundbreaking, hopefully, work to set for the rest of the U.S. So these are kind of model projects. We are also, in 2026, we are fully implementing now our 2025 to 2030 Community Health Improvement Plan, and that has been rolled out. We have work groups on the various topics, and we have some work that we are going to be doing to support the county's 2050 comprehensive plan. As that work is being kicked off now, we are, as we did 5 years or 10 years ago, I guess it was a long time ago. We assisted with the community engagement on the 2040 comp plan, and we are also, once again, utilizing some SHIP staff to help with the community engagement on the comprehensive plan. We will be doing some process improvement and looking at some efficiencies related to some revenue recapture and expenses, related to some of our mandated services. As you know, we are being asked to do more and more of required mandated services, and we are going to be trying to look at other, maybe some unique opportunities to recapture some of that revenue through possibly billing for some staff that we haven't in the past, community health workers, so we'll be looking into that. And as we open up now the Integrated Health Center, we're going to be working with our existing clients that we have had, longtime clients in our Health Matters Clinic, to get them to connected over to the community, to the Integrated Health Center, and possibly the clinic over at the CAP agency. And we also, I think Mary Kay will talk a little bit about this, but we are partnering with the St. Francis Birth Center to really, right out of the chute, literally, to work with some moms over at St. Francis and introduce them to public health services, particularly family home visiting, and getting them connected with community resources and ongoing support. So those are just some of the highlights for 2026 for this year. As always, our work continues. We've had quite a few referrals for public health nuisances in the recent past. That work continues, and we are very busy in all of our services, particularly the mandated ones. I'm going to turn it over to Mary Kay now, and she's going to do a family home visiting report. Thank you.
Good morning, Mr. Chair and Commissioners. I need this up a little higher than Lisa. Can you hear me okay? All right. Great. I am pleased to be with you this morning to give you some highlights of our data in the Family Home Visiting Program. And so I thought that it might be a good place to start with the why. Why do we do home visiting, and what are some of the impacts that we have in your communities around home visiting? First of all, it's about building strong families. We know that families are central to the full development of children, infants and young children, and it's the foundation for the future of our communities, our workforce. Many families have stressors. In fact, in 2024, the Surgeon General put out an advisory report to say families are really stressed, and because of the bidirectional interplay between the child's well-being and parents' mental health, that we need to take action to support parents. So this work is really about preventing adverse childhood experiences, promoting positive childhood experiences, and building the protective factors in families that we know are so important and that make a difference. As an intervention, family home visiting aligns well with the board strategy of building strong families along with our partners and making sure that kids have safe, healthy, successful lives, and specifically the strategy about promoting child development and resiliency by working with our partners and doing upstream prevention and early intervention. It also aligns with our prevention, I'm ahead of myself. prevention, of our priorities in our community health assessment. 3 priority issues in the most recent community health assessment were substance use and mental health, chronic disease prevention and management, and access to healthcare, housing, and transportation. And because we know, because of the growing body of research, supporting the importance of early childhood for lifelong trajectory of health, that these priorities can be impacted potentially by the prevention efforts of evidence-based family home visiting in particularly. Outcome impacts. By strengthening families in their communities, family home visiting has shown powerful impacts on family and child well-being, including positive pregnancy outcomes, school readiness, child abuse prevention, and family self-sufficiency, which decreases the need for those deeper end services. And lastly, the return on investment you've heard me mention before. The National Home Visiting Resource Center says that there is a return of investment of $1.80 to $5.70 for every dollar spent on home visiting. And so this strong return is some of the most effective established research on early childhood interventions, and it makes it a smart investment for our taxpayers. And we have, and home visiting, enjoyed long-term bipartisan support, and I anticipate that funding will continue to be invested in the future. All right. So a little bit about how we're doing home visiting. What is home visiting? Just what it says. It's highly trained professionals meeting families where they're at, starting early, ideally in pregnancy, and following with them through the early years of a child's life. Services are individualized to meet the unique needs of every family, what their priorities and their goals are to be the best parents they can be, the strongest family they can be. And across the state, there are home visiting programs that are looking to identify any family that would benefit from home visiting. It's estimated by MDH that we're only serving across the state about 10% of families who would benefit. So we're always looking to promote any opportunities to support families. So you've seen this information before. In Scott County, we really have 3 models. 2 of these are evidence-based models. The maternal child, early childhood sustained home visiting, which is a mouthful, we call it MESH, is a state program, state-administered program, really where our nurses are working with pregnant parents and new babies up until children turn 2. And then we have the next part of our continuum, which is parents as teachers. Parents as teachers can serve prenatally to kindergarten, but we really developed this program when we converted to both of these models 2 to 3 years ago to focus on the preschool toddler age that may have fallen through the cracks during the pandemic. And so as if they're not eligible for MESH any longer, then we would offer them parents as teachers, and that has a really strong emphasis on school readiness. And then our traditional or evidence-informed brings in all of the same best practices that we do in the evidence-based models, but this is for those who might just need a 1 or 2 time visit, a weight check, some safe sleep education, some connection to resource, and they say, no, thanks, we're good, thank you for the resources. So we have a mix of that, and in the models, we have a lot of fidelity measures where we're looking at and working on all of the time. We have some caseload caps to make sure that we're able to bring the services that are expected to families so that they're getting what we know makes the difference. If we had every spot filled in our evidence-based home visiting models and our traditional, our full capacity is 143.5 families right now with our FTE. All right, what happens on a home visit? Just to illustrate, as I've said, these things that we do on visits are to link pregnant women with prenatal care, support parents early in their journey as their child's first teacher, ensuring that kids have a safe and healthy environments, and provide parenting skills and support that increase outcomes. So our visits are provided by well-trained RNs, PHNs, and parent educators, many of whom are in the room today. I'm very proud of the work that we do, and I can tell you have a stellar team working in your communities on your behalf. Many of them have lactation training, certified lactation training. Some have infant mental health endorsement certifications, which mean we've got a strong foundation to really support those early parent-child relationships. We do a lot of screening on home visitings. We screen for depression, anxiety, substance use concerns, interpersonal violence, Every child has a developmental screen and a social emotional screen at different periodicities. And we also have some tools to look at parent-child interaction. So I'll share some data about some of that in a minute. And we do a lot of connecting to resources and things that people need in the community, Shakopee Community Assistance, cribs. We're able to provide pack and plays and some safe sleep education. We connect people to car seats through their health plans and other programs in the community, and just many, many other things that families might identify they could use support with. The goal is really to empower and connect them so that they can parent despite their stresses well beyond when we're involved with them, so that they know what's in the community, they know where to go. We want to help them adapt and self-manage and have strong aspirations for their future. All right, so by the numbers, this is 2025 data. We had 370 referrals come in for home visiting. Of course, there's a variety of outcomes that happen. Some people we never reach, some people get a phone call and some resources. Thank you very much, I think I'm great. Some people might get a visit or two and that meets their needs, or they drop off, and then others will enroll and stay with us for that 2 to 5 years, potentially, where we can see the strongest outcomes and where we have the most data. Some people fall off and we try to re-engage them. Some people move. We have about 20% of the people that closed last year moved out of county. So we connect them in their county that they're going to if they're interested in that. So we saw 371 clients. That would be 162 babies, 185 families, and between all of the programs, we did 2,455 visits. We had 17 babies born that were served prenatally in 2025. And as you can see here in the chart on the right, just to represent sort of how our programs have been growing, and as we've strengthened in our PAT and had more capacity, things have kind of split between the differences in the model. MESH visits them more intensely in the beginning and tapers towards 2, and PAT is pretty intensive all the way through. So, all right, so where do those referrals come from? These are the top sources. We have much more detail about this, but most of our referrals come from the clinics, other health departments, other health agencies, hospitals, not just St. Francis, but all the places that our Scott County families deliver. WIC has been a strong referral source, particularly since coming in-house, and then you can see a gamut of some other things. Self-referrals, always lovely. A lot of friend referrals. Word of mouth is powerful around these programs and experiences. And you can see on the right the reasons. Most are pregnant. That's our best opportunity. We love to build that relationship before the baby's here. We have lots of postpartum referrals and all kinds of parenting and growth and development concerns where people might need help too. All right. Just to show you a little bit about some of the risk factors, this is from our Ivy data. So these are people who have enrolled with us and at least had some visits. You can see sort of a breakdown of the stressors that families are experiencing. And this isn't a one-to-one representation, but here's a map showing you kind of the distribution of visits that were all over in the county. The team will tell you they're driving out to New Prague, they're driving out to Elko New Market, they're driving out to Belle Plaine to visit families. And of course, the majority is where our larger population are, but we are pleased to get out and serve anyone who's interested. All right. A little bit about the known impacts, looping back to the outcomes. These are the things that are the protective factors we talk about. These are the things that the evidence has shown that we can really have an impact on. And so some of the data we're highlighting today reflect how we're doing in those areas. So we work with expectant caregivers to ensure they're getting optimal care in pregnancy. Participants in home visiting are more likely to access prenatal care and to carry their babies to full term, less likely to have a low birth weight baby. Healthy babies, home visitors educate parents on caregiver practices which contribute to babies' health overall. There are higher rates of breastfeeding also in mothers who are in home visiting compared to non-participating families, and breastfeeding is strongly associated with a child's cognitive development and positive maternal and child health outcomes. Safe homes, we improve safety by increasing parents' awareness of safe practices, potential hazards, car seat use, lead exposure, shaken baby syndrome, for example, and parents in home visiting implement more safety practices like safe sleep and mobilize more resources toward their children than non-home visiting participants. They're likely to less need emergency medical care compared to families not in home visiting. Nurturing relationships. Home visitors teach parents how to engage with their children in positive, nurturing, and responsive ways, which helps reduce child maltreatment. Families in home visiting have fewer child protection reports than families who do not, and show more positive parenting practices and interaction with their children compared to peers not in home visiting. Optimal learning and academic success. The research has shown that home visiting can benefit children's overall health, development, and well-being. There's a theme, I think I've probably said that 4 times. Children whose families participate in home visiting receive more stimulation and support for learning, more reading with their parents. Compared to non-participants, services can improve the quality of the home environment, and in the long run, children of home visiting participants demonstrate greater math and reading achievement, reduced absentee rates, and decreased in and out of school suspensions compared to their peers. And then thriving parents. Home visiting helps parents set goals to support their parenting, mental health, financial, and educational well-being. This support can translate into better education, better employment outcomes. Compared with their counterparts, parents enrolled in home visiting have higher monthly incomes, more likely to be enrolled in school, and more likely to be employed. For mothers in particular, home visiting improves physical and mental health, reduces depressive symptoms, and parenting stress. Several studies show that participating parents are more likely to be enrolled in school or training and to be employed than non-participants, which lead to greater earnings in the long run as well, impacting that self-sufficiency and financial stability. All right, so how are we doing? Some markers in our data from 2025 on maternal and child well-being. You see that 100% of our babies indeed were born, that were served prenatally, were born to full term or early term and at a healthy birth weight. And if you look at our population of those that had their babies but weren't enrolled prenatally, that is lower. So you can see that is true. 72% of parents screened for depression had no concern. Of those who did have a concern on a screening, 61% were connected to supports if they weren't connected already. 89% of babies are always placed on their back to sleep, which, as I mentioned, we do provide cribs and talk about safe sleep with everyone. And 87% of babies were breastfed any amount at 6 months to those moms who were enrolled prenatally. So when we have the opportunity to connect with them before the baby's here, we can help prepare them for those better outcomes. Well checks and immunizations. You can see here that children are 98% up to date on their well checks, 89% on their immunizations. If you compare that to Scott County immunization rates overall, the percent of complete vaccination series for 2-year-olds, which is really the vaccinations prior to when they're school age, is 64.8%. So families are doing well in that regard. Healthy People 2030, the target is 90 to 95%, depending on which vaccine you're talking about. And when, there's about 80% coverage in Minnesota in recent years. So families are keeping up with those. Developmental screening. All kids in the program are enrolled with a developmental screening tool and social emotional screening tool as the model periodicity requires. So we had 71% of kids in 2025 with no concern on their development on a screen, 92% with no concerns on a social emotional development. And keep in mind, for some kids, they come with conditions that automatically make them eligible for services or might prompt some delays like prematurity or some other conditions. And others get identified through our home visiting services, and then we help get them connected to early intervention or medical services that they might need. So we're making sure kids aren't getting missed and that the interventions and supports are in place sooner for these kids. Parenting. We do assessments and surveys throughout the program. And on the left, you'll see that one of our assessments shows that parents report feeling their skills, practices, and capacity have improved. We had 100% of families that completed that assessment that feel that that has improved. And on the right is in some of our survey data coming together that parents feel that they've improved protective factors and feel more enabled as a result of our services. And I apologize, the percentages aren't there, but it is, in 2025, it was 99% of parents felt that more enabled or that their protective factors had improved. 89 the year before that, 96% the year before that. School readiness is a huge part of what we address with families. One of our questions that we talk to everybody about is reading, talking, singing, telling stories daily. You'll see here that 88% of families in our programs are doing that. 96% of our 3-year-olds, we've had a lot of emphasis on early childhood screening. In our home visiting programs, 96% of those 3-year-olds have had their early childhood screening completed. Early literacy is woven and integrated into all of the things we talk about on visits, and we provide a lot of books to families as well. All right, I mentioned before all of the referrals and connections that we make. This is actually a subset of the full data. In 2025, we had 705 referrals out. I think that's probably actually low because not all of them get fully documented in the reports, because when the visitors meet with families, they might say, okay, these are 5 things you need to know about. They might not need them, but we've planted seeds if they need them in the future. Some of those things are a little less directly documented, so I think that's low, but when you look at the referrals out overall, social services and financial supports is the largest wedge of where we connect people. It's about 49%, and you can see here the breakdown of that: financial assistance, food shelf, health insurance, housing, legal resources, a gamut of other charitable services. I mentioned Shakopee Community Assistance and our diaper bank, WIC, all of those things. Following that, 14% of our referrals out are related to healthcare services, 13% child development and parenting supports, like some of our groups that we do at the Family Resource Center, some of the groups we're doing with the ECFEs. And I know it's not just enough that we connect them, so we looked at the data. About 67% of individuals that with a referral out followed through and completed those referrals. Sometimes it's their choice, sometimes it's their barriers, but that's a pretty good rate of follow-up. Also zoomed in on this subset of data of the full referrals out, just to note that we took a quick look at some of the 2026 data, and it was remarkable that the rate of referrals for food shelf and food services significantly increased this first quarter. I think we connected 54 families, which if we kept on that trajectory would far exceed what we've done in past years. I think a lot of it had to do with Metro Surge. The team was really busy helping make sure people got connected to things that they needed. So I think we'll be digging more into the impacts of that in the data in the future. All right, some of our most important outcome data is the feedback we get from parents. We do surveys in the programs. Some of this is specifically what we've asked about, what's been most helpful, and others, there are tons of beautiful comments naming home visitors and talking about how services have benefited families. So they're overwhelmingly positive results, and just evidence of the relationship-based work that's happened. And because this work is about people, I would like to end with a bit of a story or two. This mom had a history of substance use, and had been sober for 3 years. When she became pregnant, she was unsure how she would adjust to having 2 children and worried about her mental health. She did end up experiencing some postpartum depression and struggled with breastfeeding, and was thankful to have the support of home visiting to support her in her postpartum journey. She breastfed her baby for 5 months and was able to get connected to a mental health provider to continue to care for her mental health so she could be the best mother for her children and care for herself and her sobriety. Another mom noted that the support home visiting was a foundation for her confidence in motherhood. She enjoyed using visits to discuss topics regarding her child and get answers to her questions from a reliable source. Through home visiting, she was able to get her child connected to early intervention when he wasn't talking as much as he should, and this decreased his biting behaviors at daycare as he was able to communicate more. So these are small things, but we talk about in home visiting how small things for parents mean big things for babies. And so we're always pleased for all the amazing change we see for families every week. There are many more stories like this, much more data, and I will just leave an open invitation for anybody who would like to talk further about that. And lastly, I will just highlight a few things that we have going on in 2026. Lisa mentioned the St. Francis Partnership. I met with them yesterday. We're talking about how we might connect with parents there. It's a super exciting opportunity to strengthen that relationship as one of our primary referral sources. We are in the process of our Parents as Teachers Blue Ribbon Accreditation, also known as our QEIP process, or Quality Endorsement and Improvement Process, which really is about looking at us as an affiliate of Parents as Teachers and making sure that we're meeting all the fidelity measures and that we're looking at quality improvement and bringing the best for families. So we've submitted all of our documents, we've submitted files, we have completed a large narrative about how we do things. Friday, Rocky Sodetani, who leads in this program along with me, will have an interview with the National Parents as Teachers Office, and then we will submit our annual data this fall. And when that's all reviewed, we should hear if we're fully accredited at the highest level, which is also another piece of sort of proving that this is a smart investment, that we're doing the right things for families and having an impact. The following program has some changes happening statewide. We're moving to an online questionnaire system with the leadership of MDH and expanding to serve kids from 0 to 5. We send out an invitation to all new births in Scott County. Right now it's 0 to 3, so that will be growing and a little more accessible. Paper will always be available for anybody who's not able to access online or has that preference. Lisa mentioned the NACO project. We'll be a part of that. I'll be going with Commissioner Weckman-Brecky to DC in June for some of that work. We are going to be working on a full family home visiting outcome report this summer. We have program data, fidelity data, outcome data, just volumes of it that we'd like to put into kind of a package for people to reference if interested. We're very excited. We've added some bilingual staff. We now have a Spanish-speaking nurse in the MESH program. We have a Spanish-speaking home visitor in the Parents as Teachers program, so we've increased that capacity. And then we're looking forward to bringing into practice some of the trainings that we'd had in 2025. Many of the staff have been trained in some really powerful interventions that have proven to be effective. Circle of Security training, mothers and babies training, which impacts maternal well-being. Tomorrow we're attending a HOPE framework, which is about how to support those parent positive childhood experiences, ACEs and prevention. And then, yeah, I think that's everything. So unless there are any questions, I will hand it over to Jody.
Questions?
I don't have a question, but I used family home visiting in my life, my personal life, many years ago when my child came home with health issues and developmental delays. And I remember coming home and it's like, well, now what? You know, with the baby. In the first week, I would say it was the Scott County nurse who called me and said, well, why don't I stop by and talk to you about things. And she was able to connect me with early childhood development or early childhood classes at the school district, and also offered to follow up with me. We didn't use that person very long, but it was really a relief to know that it wasn't just me who had to figure out everything, that there was always a backup person that was behind there that I could utilize. So I think it's a great program, and I'm glad to see that it's still, after all these years, is still happening and is still important to our community. So thank you for the presentation.
Thank you. Thank you for your firsthand story.
Got a comment I would like to make under the idea of what's next. I'm going to suggest something that kind of relates to a little bit of a personal journey I've been on in terms of health. But I'm going to suggest that you consider a 2027 initiative of healthy living for county-wide, that you decide, you get a group of your public health type people together and discuss what are elements of healthy living, what are practices of healthy living. How could we further the idea of healthy living across our county? Just to give you an idea of my personal journey, there's now 4 aisles of the grocery store that are kind of like off limits to me. I don't go down the cereal aisle, I don't go down the chip aisle, I don't go down the cookie aisle, and I don't go down the pop aisle. Well, that's like life-changing difference for me. I'll give you another one. There are certain products that I grew up, that, like just loving and thinking I was eating the best of the best, like mayonnaise, think of the number one brand of mayonnaise. Look at the label. It's loaded with seed oils and sugars and chemicals, and long list of chemicals that you can't pronounce. Then there's one over here that's made with avocado oil, and there aren't any weird ingredients in it. Same with ketchup. You look at ketchup, and the number one ketchup that I ate, well, I didn't realize at least a third of that is sugar. And there's another ketchup over here that's tomatoes and no sugar. Those are things that I need to be educated on. So if you were to consider what, this also came up with fish. We have a monthly topic of compelling interest to the partners, and I suggested let's have community health come and talk about healthy living. What are elements of healthy living? I mean, you talk about diet, you talk about sleep, you talk about exercise, and I had vague ideas of what these were. And my doctor even showed me a chart years ago. He said, it's your weight. Based on studies, you're going to live 4 years less than you should, just based on your weight and statistics. And I just kind of blew that off. Well, then so some things triggered, me to be more serious. And I am now. And I'm not sick or anything. I'm not ill. I'm not, you're going to wonder why I'm losing so much weight, though, but I'm not sick. I'm just trying to get to a proper weight. But anyhow, I would suggest considering, our insurance costs would go down, the vibrancy of your community would go up, brain fog would, lots of things would be taken care of with a healthy living initiative if people bought on to that, and so I just throw that out as maybe a consider for 2027.
Yeah, I think that falls very much in line with our community health assessment and our chip in our chaw, as we call it, our health improvement plan, towards working with our partners and promoting chronic disease prevention and healthy lifestyle. A lot of that work falls within our SHIP area. So I anticipate you're going to continue to see work in that area and others in the department who can speak to that more deeply. But yeah, absolutely, it's important.
All
And
right.
that's what we heard from others in the community as well from that assessment process.
And I think there is somewhat of a sea change happening in this area in our country. I think we're in the leading edge of it. It's now more prominent that we eat a lot of things that they don't allow in Europe. The dyes or the ingredients of things like cereals, or they just aren't allowed in Europe because they're not healthy, and we've allowed them. And I think a lot of that's going to change, but I think we're on the leading edge of some of this.
Any other questions for me?
If I can, I'll bring one up. He brought up mayonnaise, and my wife made me get this app on my phone. And mayonnaise, I think, is 0 out of 100, but it tastes really good, Huh?
Avocado, try the avocado.
I actually haven't, I'm
The
telling
poor egg in and out of favor, right? The poor egg in and out of favor.
you. It's funny, you look at a product and you think, oh boy, that'll be really good, and 3 points off.
Yeah. Well, speaking of nutrition, I will hand it over to Jody. She'll talk a little bit about how nutrition is part of the WIC program. Thank you.
Good morning. Thank you for having me here today to talk about a great program, our Women, Infants, and Children, or WIC. So what is WIC? WIC is a program that brings nutritional foods to pregnant women and postpartum women, and then children birth to 5 years of age. It provides a specified food package depending on what, if you're pregnant, if you're postpartum, and your age. Benefits are all loaded electronically onto a card now. It's easy to use. There's a great app that families can have on their phone when they're shopping to help them to utilize their benefits. Every 3 months, they get 3 months worth of benefits loaded onto their card. To get the benefits loaded, they have to come see us or talk with us on the phone because we want this to be more than just getting some food. We want it to be a relationship building. We want it to be a time of education around nutrition. for families. And we also want to be able to connect them to any resources that they may need. So if you remember, WIC came to Scott County back in 2022. Prior to that, it was administered at the CAP agency. In January, we started WIC here and in Carver County. Virtual appointments initially because we were in the midst yet of COVID. And then in August of 2023, we moved from virtual to a hybrid system. So 2 times a year, families come in person. They get their heights, weights, and hemoglobins done as they're needed. And then 2 appointments a year are done on the phone. Families, just to be able to make things flexible and more workable for families, they can come in and get their height, weight, and hemoglobin done, and then we can do a phone visit with them later if need be. Sometimes we're just able to see them and do the whole appointment when they walk in. So whatever works for the family, we try and accommodate their schedules. Right now, we're in the midst of reapplying for the next 5-year WIC grant cycle. So the application has been submitted. We're doing some follow-up question answering for MDH, and we should be hearing sometime this summer about the next 5 years. So the goals of WIC really are to, similarly to family home visiting, to improve birth outcomes, promote healthy growth and development, prevent nutrition-related health issues, increase access to healthy foods, support breastfeeding, because we know that breastfeeding is one of the best public health tools that we have in our tool case to prevent chronic illness and promote health. We provide nutrition education, and we connect families to services. Our clinic locations have grown over the course of time that we've had with us. So we started with locations at the Scott County Government Center and then at East Creek Family Services Center for Carver County. We've now expanded to providing services at the Shakopee Family Resource Center, at the Savage Library in connection with the Family Resource Center there. We're now at the Jordan Library once a month. New Beginnings, which is a school-based program, which used to be at the East Creek Center, moved to the Dean Lakes School. And so we go out there now as needed when they have women there that need services. We're also moved from the East Creek Family Service Center because of some changes they made, and we're now at the CAP agency in Chaska for Carver County. And we also started services at the Waconia Library for Carver County. So like I said, one of the big things with WIC is we issue benefits, food packages to our families. This is showing the number of households that were issued benefits over the last couple years. You can see a couple pretty significant dips. One of them was when we started in-person services again. Took families a while to get back into the rhythm of coming into the clinic. So we dipped down a little bit, but bounced back up. And then the last dip was Metro Surge, where we did see a significant decrease in benefits being issued to families during that time. But again, that has picked back up also. Overall utilization of our WIC benefits has been really pretty steady through the years. It hasn't changed a whole lot. And so one of the things that our team is working on right now is how can we just bump it up a little bit more? So that's kind of our team goal for this year is how do we increase utilization of our benefits? So right now we're sitting about 60% of the WIC benefits that are issued are utilized. So we want to increase that. So we're doing some different things like we came up with a recipe book that clients can come and pick out recipes that include foods that are in their WIC packages. So we're doing that. That we just kicked that off with getting all the recipe cards printed. And then we're also trying to, when clients are coming in, we prep for the visit by pulling a report that shows the utilization of their benefits, and they can spend some time talking about what they're using, what they're not using, why aren't they using it, and then just some ideas of how they could use those foods also. So we're working on that. Of course, utilization of benefits means more dollars into our community as they purchase foods in the grocery stores. In federal year 2025 in Minnesota, $98.9 million went into the economy from WIC foods being purchased at the local grocery stores. And then approximately a third of that were fresh and frozen fruits and vegetables, which is a new package, well, not so new anymore. It's probably been maybe 6 or 7 years that they actually get a cash benefit in their food package where they can purchase fresh and frozen fruits and vegetables. So we're happy to see that a lot of that money is being used for that. The economic impacts to that, so this is specific to Scott County. And in 2025, it was $1.5 million that was spent through WIC benefits for Scott County. So we like to see that money coming back into the community. So one of the things I talked about is that with clients that are on WIC, we have better birth outcomes. Now, this slide in the getting it transferred, cleaning things up a little bit, something got switched. So where it says no prenatal WIC, that should be actually at the top. So if they don't have WIC prenatally, 20.7% have a low birth weight baby. And a low birth weight baby is defined as a term baby that weighs 5 pounds, 8 ounces or less. Okay, so then if they have less than 3 months of WIC prenatally, 16.9% have a low birth weight baby. If they get over 3 months of prenatal WIC, only 6.6% have low birth weight babies. So we like to see that that nutrition really plays a big part in a healthy pregnancy and a healthy birth outcome. Anemia is one of the other things that we watch for in WIC. Anemia is red blood cells. Red blood cells are what carry oxygen to your body. If you don't have enough red blood cells or hemoglobin to connect to the oxygen, you end up with not enough oxygen throughout your body, but also in your brain. So inadequate oxygen levels can lead to developmental issues for kids. So we check hemoglobin starting at 9 months and then yearly thereafter, as long as it's within a normal level. This is a graph showing how many participants we've screened over the years, and then how many have actually had a hemoglobin of 11 or below. At 11, we recheck it. At 10, we refer them to their provider, whether it's an adult or a child. They'll get a referral. So we do a lot of hemoglobins in WIC. This is a slide that I wanted to talk just a little bit about because we don't talk very much about our peer breastfeeding program. So we have a program that is connected with WIC where we can connect our WIC clients with a peer breastfeeding support person. And prenatally and postpartum, this person connects with the mom and just provides support. They're there to encourage them. They're there to provide information. They're there to just be a support for them with breastfeeding. So we looked at, and we actually had to pull this report for our application, but we looked at these numbers, and I'm amazed at these numbers. So what this chart is showing is initiation of breastfeeding at both the Scott and Carver County. And then the first column is participants receiving peer services, and the second column is participants not receiving peer services. So initiation, 96.1%. That's so close to 100% of our peer-supported families that are initiating breastfeeding. Whereas when they don't have, it's 84%, which is still great. But 96.4% or 96.1% that initiate breastfeeding. And then if you look at duration, and duration is always a struggle, that how do we keep moms continuing breastfeeding? And if you look at those numbers, at duration of breastfeeding with a peer support in Scott County is 45%. So almost 50% of moms that initiate breastfeeding are still breastfeeding at a year when they have the support of a peer. If they're not receiving peer support, they drop down to 23.7%. So it makes a big difference to have that peer support. So I really wanted to take this opportunity to talk up our peer breastfeeding support people, because they do an amazing job of supporting our families. All right, so referrals, connecting. We connect families to services. We just pulled the family home visiting because we know that rates were low when they were at CAP of getting referrals from WIC to family home visiting. And we have definitely increased those rates. Now, we peaked in that 2023 as we got really settled here. And of course, you offer, and we offer to 166 families, or refer to 166 families, I should say, sorry. And yes, the numbers have gone down, but our families stay with us for 5 years. So we've offered, they've either accepted, and so now we don't have as many people to offer it to because they've already talked to them. But our WIC staff do talk with families prenatally at postpartum, their first postpartum visit or two, about family home visiting. And then I really encourage them that if they're spending some time talking with the family about a specific issue, if they just have a feeling that they're struggling a bit around parenting, offer again, because that's one of the beauties of having parents as teachers now, is that we are not set just on those prenatal and postpartum. We can introduce a family to family home visiting when they're 2, 3, or 4 years old. So that's our connecting to resources. Like I said, I just pulled family home visiting. We connect to many, many resources, very similar to family home visiting. And what are our families talking about? That's really the heart of what we're doing, is to serve our families. And so I just left some quotes on here. Some are from peers, some are from through WIC, but what our families say about the program. And that is it. Do you have any questions for me?
No, thank you. Very good.
I'll let Dr. Wilcox up.
Thank you, Jody. Commissioners, it's great to be back. Nice to have an opportunity here today to chat with you about a clinic initiative that we first embarked on in 2009 called the Health Matters Clinic. And we're going to be talking about that, the history of that here over the next few minutes. You know, the Health Matters Clinic was originally developed with a focus on one of the missions that we had in the public health area of access to health care. In particular, we were looking at ways in which we could provide access to health care for individuals who are underinsured or not insured at all. It was originally developed to fill a gap, we thought, for those folks in our communities who were underinsured. In order to embark on that, we then went in collaboration with the Metawakan Sioux community, who had a mobile clinic at the time in 2009, and we instituted a free clinic venue where we would take this mobile clinic to various parts of the county to provide patient care free every couple of weeks. We developed kind of a trap line, as we would call it. We would spend time in Jordan. We would then move up into the Savage area. We'd come back then into the Shakopee area. And we utilized this clinic during that time to provide free care for individuals in an effort to give them access. We focused in particular on individuals who had a tough time getting to the clinic. Transportation was an issue for some of these people. We instituted this program then for them to become a part of the process. We could provide medical services for them in a fashion that was appropriate. We also developed opportunities for immunizations that could be provided for them. And we did this for the first several years then in moving around the county with this mobile clinic setting. Now in 2020, when COVID hit, that operation had to be stopped. And at that point, the individuals that we were working with within this clinic venue actually came together and assisted with testing for COVID. Many of our resource people assisted with that and provided later on vaccinations for COVID as well. Now, once COVID then ended up being a major issue for us, it was elected to move this free clinic venue into a setting that was perhaps a more stable setting. And at that point, we moved it into the governmental center, the new governmental center in the community health area. And from that point on, every 2 weeks, we would provide free clinic options for folks to visit us who, again, had a need for access. And we have continued to do that right up to this point successfully. As I have suggested to you, what we were striving to do through this was fill a gap. We wanted to fill a gap in healthcare access for individuals that unfortunately, when we first started, could not get healthcare in a timely manner. What we have done, I believe, successfully with many of the folks, resource people we have here, have developed options for individuals when they come to this clinic to achieve an opportunity to find a medical home down the line. We assist them with finding healthcare insurance and later on a clinic venue where they can go to for further follow-up care. I believe now we're at a point where we have really successfully done a lot of what that mission was that we first looked at in 2009 in developing the Health Matters Clinic. As such, what we're looking at now is a timely approach to ending that type of clinic care within our county. And we have a transition plan in place where this termination of this service will occur over the next several months. We do this with a thought in mind that we already have now, as listed in our graphic here, 2 clinic venues where folks may continue to access health care. The first one is the River Valley Health Services, which is embedded in Shakopee here at the CAP agency, and there's a wing of this also in Carver County that provides this type of access to health care. We also have now in the Integrated Health Center a new clinic called Open Door. And this is a federally qualified healthcare clinic. It opened in March of this year, and it continues now to do very good things in providing access to health care for the citizens within our county. The beauty of this is that they have additional resources, and I'll cover that in just a little bit. But as I suggested to you, we have a plan in place to perhaps transit to sunset the Health Matters Clinic. And what you can see here are the 4 phases of this operation that we're presently going through. Phase 1, the preparation, we've already focused quite heavily on that, and we've moved now from that into Phase 2, the actual transition. And what this is indicating then, we continue to have this Health Matters Clinic twice a month. We continue to see patients up to 8 per session, 5-hour session each time. During this time in transition, we will then have these folks introduced to other options of clinical care, including Open Door or River Valley, that they can move to by the end of the year. The Phase 3 of this transition then will occur in June and July, at which point Health Matters Clinic will actually transition to a once-a-month venue. And then in August, as of the 1st of August, Health Matters Clinic will no longer exist. So that is the transition plan. That will be the Phase 4 That would be the closure of this clinic. I would continue to really focus, however, on the values that have guided us in this transition and will continue to move ahead for access to health care for our citizens in the future. We will continue to guide us in transition by focusing on individuals who will have no loss of contact and ability to get clinical services. The beauty of this new clinic operation at Open Doors, it also expands services. So they have embedded within their program opportunities for dental care, expansion of mental health care, expansion of chemical dependency care, and initiatives in doing actual lab testing and so on that we have not had available within the Health Matters Clinic. They also have resources available with their other partners to assist in, if necessary, consultation with specialty groups that needed, some patients need additional care in the specialty areas. They have that capability to do that work for them. And of course, we will continue to be client-centered. This has been very much a part of our mission over the years, and that will continue to be the case. So what's next? I would suggest to you that the mission of our public health folks within this county will not change. I can tell you that that mission will not change. We're going to be continuing to provide a foundation of robust public health care to the citizens within this community. We will certainly continue to strive to prevent healthcare-related issues. Commissioner Ulrich, you brought this up. We can educate perhaps our population on some lifestyle issues, for example. We'll continue to focus on that to promote health and so on. We will also be able to provide ongoing mandated services in healthcare that are appropriate for the citizens of our community. And the bottom line is we will continue to work to improve healthcare access to the folks within our county, short and long term, with this operation. Now I'll open the floor up for questions. Do you have any questions at all about this transition that we're talking about in the Health Matters Clinic venue?
Seems like a very good transition to probably reduce costs, consolidate effort, and still provide access and expanded services. So it seems kind of like a win all the way around.
It's a natural progression, quite honestly. We've really been striving, I think, to achieve this level of patient care access, and now it's a matter of next steps to move on.
Very good.
Thank you.
Thank you. All right, is that all of the presentations? It is, okay. Thank you very much. Any comments or questions from anybody? We'll take a motion to adjourn.
So moved. Second.
There's a motion and a second. We'll call the roll.
Commissioner Weckman-Brecky,
Aye.
Commissioner Wolf, Commissioner Brennan,
Aye.
Commissioner Beer,
Aye.
and Commissioner Ulrich.
Aye, thank you. Motion carries, we're adjourned. And do you want a 5-minute break, or do you want a 5 or 10-minute break? We'll take a 10-minute break between now and the board meeting. Our microphones are not on. Are we ready? With the microphones are on now. Okay, we're convening the county board. Let's arise for the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Before we get into our agenda, I want to mention that Commissioner Weckman Brecky is attending the NACO Western Interstate Conference on our behalf, and so all votes this morning will be remote. She's right here on our screen and going to be voting remotely. So thank you for serving and being away representing us at NACO. All right, we've convened the board. Next is amendments to the agenda. Do we have any amendments to the agenda? All right. Item 3 is to approve the minutes for April 21st. Do we have a motion to approve the minutes?
So moved.
We have a motion. Do we have a second?
Second.
Motion and second. Call the roll.
Commissioner Weckman Brecky,
Aye.
Commissioner Wolf.
Aye.
Commissioner Brennan,
Aye.
Commissioner Beer,
Aye.
and Commissioner Ulrich.
Aye. Motion carries. Item 4 is recognition of interested citizens, and this is limited to 5 minutes per person per subject, and it's limited also to items that are not on the agenda. And speakers are encouraged to come to the microphone and tell us what they would like to say. Good morning.
Good morning. Mr. Chair, Board of Commissioners, you know that I'm Jen Schultz, Scott County Library Director, and I just wanted to take a few minutes this morning to recognize National Law Day, which was officially on Friday, May the 1st. Each year we celebrate National Law Library. This year in 2026, the theme we reflect on is the rule of law and the American dream. At its core, the American dream depends on systems where laws are clear, accessible, and applied equally, where justice is not a privilege, but a promise. Law libraries play a vital role, yet often under-recognized role, in making that promise real. They are gateways to legal knowledge, ensuring that attorneys, judges, and our residents alike can access information necessary to understand, interpret, and apply the law. In an increasingly complex legal system, law libraries remain steadfast in their mission to preserve legal history, provide resources, and support informed decision-making, and are a pillar in our legal system. Equally deserving of recognition is the work of our law library manager, Allie McNeil. Most of you probably know Allie. Her leadership and dedication ensures that these essential institutions continue to serve our communities effectively. Through careful stewardship of resources, adapting to evolving technologies, and a deep commitment to public service, Allie helps bridge the gap between the law and those it serves. To honor this year's National Law Day, Allie welcomed young artists within our communities to portray what the American dream means to them. We had 40 entries submitted by teachers from Twin Oaks Middle School in Prior Lake. The top 5 were selected through a voting process. If you have a minute today or anytime throughout the month of May, please stop down in the atrium. You'll see the top 5 entries from our young artists displayed on the wall across from the fireplace. So I really welcome you guys to take a moment to take a look at, again, our young people in our communities and what they believe the American dream is. In closing, I'd like to acknowledge that the strength of the rule of law depends on statutes, our courts, as well as our dedicated professionals and institutions that uphold access to legal knowledge that is indispensable to sustaining the ideals that make the American dream possible. Thank you for your time today. Appreciate having the opportunity to just recognize National Law Day, as well as our law library, and most importantly, the work that Ally McNeil does every, I say it every time. Ally McNeil does every day for our residents of Scott County. Thank you.
Just a comment, if I could. I've suggested that the law library have a presentation at both Scale and Fish, and maybe even more so Fish, but you know, not a full morning's presentation, but maybe a segment that'd be highly valuable at both venues to hear that.
Absolutely, Commissioner. Ally was just sharing that that was something that was brought up at the last board meeting, library board meeting that I was unable to attend. But we will definitely get on the calendars. We could do both. We could do one or the other, whatever is preferred. I do think it's important to make sure that our communities are aware. One of the things that Ally has recently started to do is she's actually providing services out of our 4 rural libraries, so Belle Plaine, Jordan, New Prague, and Elko, New Market each month, so that residents aren't always having to come to Shakopee to get information. And she has shared that that has increasingly become more popular, and residents are really taking advantage of her being out in the communities one day a month. So that's exciting. But yes, we would love to share the information and all of the resources from the law library.
It is, those two groups, Scale and Fish, are 2 dramatically different populations, so there wouldn't be
Yep.
much repeat. There are some crossover, but not much.
Absolutely. We'll get those scheduled, and we'd be happy to present to both entities.
Well, thank you.
Thank you guys so much.
All right, we're on to item 5, which is the consent agenda. These generally pass as one motion. Any item can be pulled for separate discussion. I'll read the consent agenda. 5.1 is to adopt resolution 2026-67, authorizing amendment number 4 to the Minnesota Department of Human Services Family Group Decision-Making Grant. 5.2 is to adopt resolution number 2026-79, authorizing final payment to Northland Grading and Excavating for the Cedar Lake Farm Regional Park Campground Project. 5.3 is to adopt resolution 2026-89, approving an interim use permit for River Valley Partners LLP for outdoor cannabis cultivation under a state of Minnesota Mezzo Business License. River Valley Partners LLP, applicant and property owners. 5.4 is to adopt resolution number 2026-92, authorizing entering into cooperative agreement with the Three Rivers Park District for trail work at Cleary Lake Regional Park. 5.5 is adopt resolution number 2026-93, authorizing application for a 2026-2027 Minnesota Trail Assistance Grant, and if awarded, accepting the grant and entering into an agreement with the Minnesota Department of Natural Resources. 5.6 is to adopt resolution 2026-95, authorizing entering into a service agreement with Trinity Services Group, Inc. for correctional food service. 5.7 is adopt resolution number 2026-96, authorizing accepting an urban area security initiative grant and entering into agreement with the Minnesota Department of Public Safety. 5.8 is to adopt resolution number 2026-97, authorizing amendment number 2 to the agreement with Goosebusters, Inc., Limited. 5.9, adopt resolution number 2026-98, authorizing amendment of the Keith Commissary Network LLC master agreement and its attachment number 1. 5.10 is approved payroll processing of personnel actions. That's our consent agenda. A motion to approve the consent agenda.
Mr. Chair, I'll make a motion to approve those 10 items on consent.
I'll second.
We have a motion and a second. Any discussion? All right, we'll call the roll.
Commissioner Weckman-Brecky?
Aye.
Commissioner Wolf?
Aye.
Commissioner Brennan?
Aye.
Commissioner Beer?
Aye.
And Commissioner Ulrich?
Aye. We're on to committee reports and commissioner updates. Would want to say to Commissioner Breck, if you want to make it, you can, or if you want to submit it in writing, you can as well, either way.
Well, are you able to hear me okay?
Yeah, we can hear you fine.
Oh, sure. I'll do it then, and I did submit in writing, but good morning, everyone. Good to see you remotely today. Our last board meeting was April 21st. We had workshops after that board meeting. Also that day, I had the NACO Public Health Academy introduction meeting. You heard Lisa and Mary Kay talk about the Public Health Academy that we'll be participating in over the next couple of months, and really glad to be chosen for that. Finally, on the evening of April 21st, we had the Scott County Township Association spring meeting. On April 22nd, I had Minnesota Community Supervision Advisory Council meeting. Also, that day testified at the Senate Transportation Committee about Highway 13 and hoping to get general obligation and trunk highway bonds to help us fill that gap so we can get that project completed after decades of work. On the 23rd, had Scott County Community Corrections Advisory Board. Also that evening, attended the Jordan Commercial Club annual meeting where President of the Commercial Club, Travis Evanson, had his last meeting, and Ray Sandy will be the president for the next year. On the 24th, I attended an AMC federal update webinar. On the 27th, had a SNAP Medicaid LTSS steering committee meeting. The 28th was our board workshop and our joint meeting with Dakota County. I thought it went well. I think all of us saw the Dakota County commissioners since then, and they seem to be of the same thought that there are some things we can do together and that we should continue to explore. On April 29th, we had the recycling zone groundbreaking event. On the 30th, I was at the AMC Nuts and Bolts conference, and then also joined some of you at the Capitol to talk with our legislators about Highway 13. Finally, on May 1st, had my monthly meeting with the county administrator, and yesterday on May 4th had CAP Agency Finance Committee meeting. And Mr. Chair, that's the end of my report.
Thank you. Commissioner Wolf.
Thank you, Mr. Chair. On the 21st, I met with Jeff Tate. That evening, I was at the Prior Lake Spring Lake Watershed meeting, and then the township meeting after that. That went very well. Then on the 22nd, Metropolitan Mosquito Control District, they are ramping up to get rid of as many mosquitoes as they can and ticks. Then Cedar Lake Sewer met that evening. Kind of a big issue there. They had somebody who had a sewer pipe break, and it broke right hit the middle of where our responsibility ends, and there's so it's anyhow trying to figure out who's going to pay that. So then on the 23rd, Vermilion River Joint Powers, Elko New Market that evening. On the 28th, Scott Dakota meeting, as was mentioned. The 29th, the Recycle Zone groundbreaking. Had an I-35 Finance Committee meeting that afternoon, and an audit review for MELSA. And last night, Cedar Lake Township met, and one of their items was they had the residence guide that just came out. They wanted to know if they could not get that sent to them and get the money instead. That's my report.
Thank you. Commissioner Brennan.
Thank you. On April 21st, I attended the Township Association meeting. The township had voiced some concerns about group homes, and I did pass that concern on to our Scott County staff. On April 24th, was the AMC Solid Waste Working Group. I've been suggesting that the group have a separate subcommittee for metro counties. At the meeting, the topic was regarding the Metro Solid Waste Plan comparison to the greater state plan. And they talked about the metro requirement for pre-processing waste. April 25th was the Shakopee Cleanup Day. Shakopee will be sending official numbers out to Scott County, but there was approximately 363 cars that went through the line. Cars were lined up down 4th Avenue from the Public Works, Shakopee Public Works to the Government Center. And I was able to pass out our household hazardous waste pamphlet to a lot of people. April 28th was the chair-vice chair meeting. April 28th was our workshop on with Dakota County. April 29th was the groundbreaking for Recycling Zone Plus. April 29th, I attended the MBTA meeting via Zoom. April 30th I was at the state capitol with the Scott County delegation and Mayor Christine Kelly from Savage. We were talking about Highway 13 funding. May 1st, I talked to Scott County appointed representative on the Lower Minnesota River Watershed District. Carter McNew, our appointed person, and I talk occasionally. And as well, Leslie and Brad and I have met with the administrator. And as the liaison, I attend their monthly meeting. I think they have hired a contractor to be like a person that talks to the counties. And I'm not really sure since they struggle with funding. So May 1st, I had my monthly meeting with Leslie Vermillion.
Thank you. Commissioner Beer.
Thank you. 421 post-board workshop. Later that evening, I think we were mostly at the spring township meetings. Always fun to attend those. 22nd was mentioned MMCD. I just want to point out that you are going to see helicopters, low-flying helicopters, I think over our area starting today. They might have been here already, but to try to get a beat on these skeets before they hatch. Later that evening's fish board meeting, afternoon. 27th, Community Health Improvement Committee. 28th was the joint workshop, which was talked about, and I think that is gonna yield a lot of fruit. I know, I was talking with, a couple of their commissioners a year ago about trying to figure out how to do this. You know, they're the big county. We're decent size in our own right, but there's so many things that I think we could do together as we try to all struggle with the budget handed out by the state. So that was I think, time well spent. 29th, and then we saw them again at the Recycle Zone Plus groundbreaking, another effort between the two counties, so good things can happen, and hopefully at better services at a lower cost of doing business or lower tax rate for our citizens. On the 30th, I was also down at the Capitol to talk about 13. It's one of these deals where obviously 13 is not our road, but we're putting a lot of sales tax money towards it because it's a corridor that not only does it help our citizens, it's a regional corridor. And I would argue, not only because it's a state road, but it is a state corridor with the ports and just all the commerce that goes up and down that road. To make that safer, make it safer first and foremost, but to really make it function. And there's some funding gaps there, obviously, and there's also some funding that's on the clock. So we were all down there. Many of us were down there. We talked to Senator Dibble, Jasinski, Pratt, Duckworth. I probably missed a couple, and then we caught Bakeberg and Tapke on the rep side, just to help just to make sure that they're aware of the urgency of this particular corridor. I also want to say, and I've been saying this for a long time, like I'm a big believer that the collective we can do better with better outcomes and at a lower cost of doing business as a government. I believe that. Pre-fraud, that was all pre-fraud thoughts, right? Now we know this fraud, like there's not a money issue, it's a spending issue and a fraud issue. But I think some of us have heard this. I heard this in that meeting that some of our delegations like, hey, you're not maxing out your wheelage tax. You could tax more and have more money to go towards different things. And I personally am not a believer in raising taxes that way when you don't necessarily need to. And we've heard, you have a low tax rate in the county, tax more to be able to do some of these projects. And we're already doing, as a county, carrying water for the state because along these corridors and intersections down in Jordan's under construction now, feels like it makes sense. It's a safety issue. People are dying on these roads. And if we don't do it, the county, to take the lead on some of these things, they're not getting done. So that's why we're putting our sales tax revenue towards those roads. So there's just a little divide that's not new. We're aware of that, but that was mentioned to me down at the Capitol. So to which those were my retorts. Let's see. Also, yesterday was back at the Capitol. I was invited by a representative outside our delegation and a friend of mine to be part of the Republican caucus and get on the floor, just a different side and be able to meet different side of the fence, so to speak, as far as where I was on the outside of the house waiting to catch people. Now I was on the floor being able to talk to folks and meet some new representative outside our delegation because of, you know, what we're talking about is a lot of statewide things, not just our own cute little adorable county, so that was good. And then this morning, of course, the health board. With that, that concludes my report.
Thank you. On the 22nd, I attended the Fish Board meeting, the 28th, the chair, vice chair, and then the county board workshop, and then the joint meeting with Dakota County. 29th, the groundbreaking for the recycling. Then we had fish interviews, and we have now two staff. Rachel Residence has accepted the position of executive director of fish, and she's been doing a fantastic job. We have a part-time, 20-hour-a-week second position, administrative, and that's Tasha Vital. I'm not sure if I'm Vital or Vital. Right. She has taken that second position, and so we have a great team, good connections with both of them into different parts of our community. So we're excited about that. Later the same day, the board meeting for MBTA. Then on the 4th, meeting with the Savage Mayor, Administrator, and Leslie Vermillion. And I mentioned one thing I mentioned is the Dan Patch line. And I said, and I've said to others, there's not much support for any kind of rail, light rail, commuter rail, trolley cars, or whatever you want. There's a little bit of marginal support for that, I would say. And I know Kosnick was really chapped recently. He actually said that he would support our efforts at 13 and 35 if we would allow a moratorium to go back on the Dan Patch line. Well, I didn't realize why would he even say that? Well, there apparently was a bill to seek another $1 million to study rail, commuter rail, whatever kind of rail on the Dan Patch line. And I've talked to him and a whole slug of folks from Dakota County, our county, about the idea of the Dan Patch line becoming a bike ped trail. And everybody I've talked to is very enthused about that idea. I mean, we have very limited crossings for bikes or pedestrians that get across the river. It would be a fantastic trail. And I said, you know, it's not a tomorrow or the next year or even the next year after that. If it's a 10-year initiative, it takes 10 years to get that in place, it would be worth the effort. And so I think the Savage team is very excited. Lakeville's excited. You know, I talked to Dakota County Commissioners. They would be behind it. So I think over time we had to take steps towards that. And I don't think anybody should be in the delusion that this could happen within just a few years. I think it's a long-term, steady, step-by-step approach. Then later that same day, a Mobility Management Board yesterday, and they elected a chair and vice chair. And I was elected vice chair, but there's a stipulation just till August meeting. And part of the motion was that Commissioner Brennan would become the vice chair starting the August meeting. So we need to have a board resolution making her appointment to that board effective like August 1st. So that's into my report. We're on to the administrator report.
Mr. Chairman, just want to thank a couple staff. First, I want to thank Lori McMillan. As you saw, Move It May started on Friday. And so we have staff out doing some wellness and being active. It was a good kickoff yesterday. So want to thank Lori for all her work and everything she does with that. The other one is I want to thank Sydney, sitting here next to me. This is her last board meeting for a while. She has done just an outstanding job filling in for Michelle as she's been out. And going to have a little one here coming up, so it's pretty exciting, and just really want to thank her quick learning and her ability to help. It has just been outstanding the last few months, so thank you, Sydney.
Thank you, Sydney.
Nice. And today was the first morning that I copied you on my commissioner report. So, all right, well, thank you for that report, and we're now looking for anything to recess for attorney-client.
Mr. Chair, Commissioners, nope, nothing to talk about today.
Okay. We're looking for a motion to adjourn. Got a
Second.
motion, and a second. Discussion, okay, we gotta take the roll.
Commissioner Weckman Brecky,
Aye.
Commissioner Wolf,
All right.
Commissioner Brennan,
Aye.
Commissioner Beer,
Aye.
and Commissioner Ulrich.
Aye. Okay, we're adjourned, but before we leave here, I'm gonna announce what's on at our workshop. We have a lot of topics, a lot of presentations at our workshop from nonprofits. Alice Ministry, ProAct, Guild Services, Mikasa, Damascus Way, Community Resource Min, St. David Center, and then we'll have a commissioner round robin. That will be in our workshop, but we're adjourned and we'll be going to our workshop now. Thank you.